If you're a clinician spending 2 to 4 hours a day on documentation, you've probably already heard the hype around AI medical scribes. But with over 100 companies now selling some version of this product, how do you know which one is actually worth your money? I spent the last month testing 5 of the most popular AI medical scribes in real clinical workflows. Today I'm breaking down exactly what I found. No vendor marketing, no fluff, just an honest comparison so you can make the right call for your practice. The 5 tools I tested: Freed AI, Nuance DAX Copilot, Suki, DeepScribe, and Abridge. Let's start with Freed AI. This one is purpose-built for independent physicians and small practices. You tap record at the start of your patient encounter, have a normal conversation, and by the time you walk out of the room, Freed has generated a SOAP note. The quality surprised me. It handles interruptions, tangents, and even patients who go off topic, and it still produces a clean, structured note. Pricing starts at $99 a month per clinician. For a solo practice, that's a no-brainer if it saves you even 30 minutes a day. The downside: no native EHR integration for Epic or Athena. You copy-paste. That friction adds up. Next is Nuance DAX Copilot, which is Microsoft's product and the one most commonly seen in hospital systems. If your organization is already on Epic or Dragon Medical One, DAX slots in pretty seamlessly. The quality is excellent and the voice recognition is best in class. The problem is price. This is an enterprise contract, not a solo plan. Individual clinicians can't just sign up. If you're employed by a health system, ask your IT department if DAX is already available to you. You might be surprised. Suki sits in the middle ground. It's available to both individual clinicians and enterprise customers, and its conversational interface feels more like talking to an assistant than dictating into a machine. Suki also handles EHR queries. You can ask it to pull up a patient's last lab results mid-appointment. That's a genuinely useful feature. Pricing is competitive, roughly in the same range as Freed. The note quality is good, though I found it slightly more generic than Freed on complex psychiatric or specialty cases. DeepScribe is the one I'd recommend for specialty practices, particularly if you're in psychiatry, oncology, or another field with complex documentation requirements. It has the most customizable note templates I've seen, and it learns your specific phrasing over time. It's also one of the pricier options, starting around $129 a month. But if documentation accuracy in complex cases is your top priority, the cost is justified. Finally, Abridge is worth knowing about because it's taking a different approach. Rather than just generating notes, Abridge creates a summarized conversation record that both you and the patient can review. It's being piloted at major academic medical centers. If you work in a system doing patient engagement initiatives, keep an eye on this one. It's not widely available to individuals yet, but it's growing fast. So what's the bottom line? For independent practitioners and small practices, Freed AI is the easiest on-ramp. Low cost, no enterprise contract, and the note quality is legitimately good. For employed physicians in Epic-heavy systems, ask about DAX Copilot. Your hospital may already be paying for it. For specialty practices with complex documentation, DeepScribe is worth the premium. All 5 of these tools are HIPAA compliant, but you should still review the business associate agreement before using any of them with patient data. I've linked the BAAA information for each tool in the description. The bottom line: AI scribes are no longer a novelty. They're a workflow tool. The question isn't whether to use one, it's which one fits your practice. Links to all 5 tools, including current pricing and any available free trials, are in the description below. If this was helpful, subscribe. We cover AI tools for healthcare professionals every week here.